I'd like to call the meeting of the Health and Human Services Committee to order. It is Tuesday, February 20th, 2024, and we do have a quorum present. We will be taking up 4 bills today. The first bill I will be presenting, and then we'll move from the recodification bill to 3 bills that have that relate to different professional licensing. So first I will turn the gavel over to Senator Mann to chair for me. Good morning. Thank you.
Madam Chair, when you're ready.
Thank you. And today I have Senate File 3770, which is the Department of Children, Youth, and Families Statutory Infrastructure Establishment. This bill is a very technical bill. This came about as a result of our actions last year to establish the new Department of Children, Youth, and Families. The work being done by this bill was laid out in the bill, the HHS Omnibus last year, that instructed the reviser of statutes to review and identify any changes to Minnesota statutes and Minnesota rules necessary to facilitate the transfer of responsibilities and the related operational functions. The revisor's office was instructed to do this in consultation with the commissioners of management and budget, human services, education, health, and public safety, and to make sure that we have codified in statute the language necessary to implement the legal changes and responsibilities related to the establishment of this new department. So the bill, and you have a summary that the Minnesota House Research did, which is quite lengthy, but the first 2 pages have a very high-level explanation. The nonpartisan staff have organized the language for clarity, ease of use, and removed obsolete language. And importantly, this recodification bill is not intended to change existing policy or to have a fiscal impact beyond the reorganization of executive branch functions and the establishment of a new state agency. Today, we are not going to have a presentation on the status of the implementation of the new department. There's a couple reasons for that. One is that the department leads who are working on implementation were not available today to present. And then secondly, they have a report due on March 1st. And that report is to provide an update on all aspects of the implementation of the new department. And I felt that by bringing that report forward for a presentation would be more helpful to us. The reason that we would like to move this bill right away is that we would prefer to have this bill passed off the floor in both bodies early in session, so that any subsequent bills that come forward that affect these areas can be written knowing that this language has been passed and can be written to it, hopefully I'm saying that correctly. It would just make us feel like there's less ambiguity in terms of what future bills, how they should be written. We do know that there will be additional bill language required for the implementation of the new department, but that's separate from this work, which is to just codify what was passed last year. And so with that, oh, and I also wanted to mention that in your packets, there are a couple handouts about the new department, just to remind you about what the goals and what the transition timeline is for that. We do have 2 amendments, and what I would like to do is have Senate Counsel, Ms. Hoffman-Litchie will present the bill, or present an overview of the bill, and then after that, then we will go to the amendments, and a combination of Ms. Hoffman-Litchie and Mr. Truffs, we can go through the amendments and pass those. So, did you wish to present from the table there, or you can? So I'll turn it over to Senate Counsel.
Madam Chair, members, I will be doing a high-level walkthrough of Senate File 3770 and some of the documents that are contained in your packets, and then can be available for any questions any members may have. So I want to set the stage for you all today and why this bill is in front of you. Like Senator Wiklund said, last session, the legislature passed a law creating a new state agency, the Department of Children, Youth, and Families. In that law, powers, duties, and programs that currently belong to existing state agencies were identified to transfer to the new department beginning July 1st of this year, with the transfer being complete by July 1st of next year. Some of the programs being transferred and the duties associated with those programs include the Child Care Assistance Program, certain licensing functions of the Department of Human Services, child support, adoption, maltreatment of minors reporting, juvenile safety and placement, early learning scholarships, and certain economic assistance programs. This is not an exhaustive list, and if you would like a full list, you can reference the bill summary for Senate File 3770 prepared by Senate Counsel. It has a list of the programs transferring under law and the existing state agency where they're coming from. Along with transferring certain programs and the duties and administration for those programs, the law instructed the reviser of statutes to identify, in consultation with agency and nonpartisan staff, any changes to Minnesota statutes and rules that are necessary to facilitate these transfer of responsibilities. The reviser was also required to submit draft legislation to the legislature by February 1st of this year that contains these necessary statutory changes. And that is what is in front of the committee today as Senate File 3770. Given the complexity and the number of affected statutes that were part of this, nonpartisan staff decided to move, or in some instances duplicate, statutes into 7 new statutory chapters organized by topic. And members, in your packets, there's a document titled The Department of Children, Youth, and Families Statute Recodification that was prepared by my counterpart in House Research, and it's intended to be used as a crosswalk that shows how existing statutes are reorganized and modified in Senate File 3770. And I will quickly walk you through the document and how to use it. Pages 1 and 2 provide a summary of the recodification, along with a list of some of the programs moving. And page 3 provides a list of the proposed statutory chapters and their head notes. Starting on page 4, for each proposed statutory chapter, there is a header that shows you the proposed coding and title. There is also a description of what is included in the chapter and a table. The first column of the table contains the proposed section coding and head note within the chapter. The second column shows the proposed subdivision coding and the head note of each section. And then the third column contains the current coding for these provisions. So in summary, the first 2 columns are where we are proposing to move the statutes, and the third column is where the language currently resides. And this same format is used for each proposed statutory chapter. Additionally, the table in this document includes a few provisions that were enacted in the 2023 legislative session, but were not identified in law as moving to the new department. Although these programs were not identified in law to transfer, it was understood by nonpartisan staff that these would transfer in a separate bill. Therefore, these programs are included in the table, but their language is not included in Senate File 3770. One example of this would be the diaper distribution program that we passed last session, and it's listed on page 15 of the crosswalk document, but the language of that program is not included in Senate File 3770. As the recodification was drafted, nonpartisan staff removed obsolete language and made other technical and conforming changes. This also included identifying statutes that needed to be modified, but not moved or duplicated. These proposed changes are included in Senate File 3770, but are not included in the crosswalk document because they are not moving or being duplicated. One example of this would be adding the new department into Chapter 13, and also adding the commissioner into the Maltreatment of Minors Act. Most of these changes that are not moving or being duplicated can be found in Article 8 of Senate File 3770. And now I just want to do a hopefully quick overview of the bill itself. Senate File 3770 has 8 articles, with the first 7 being the new proposed statutory chapters, and the final article being the one that contains the other conforming statutory changes. Starting with Article 1, Chapter 142A, lays out the specific powers and duties of the new department, along with administrative hearing procedures, fraud prevention activities, and juvenile justice programs. Chapter 142B, which can be found in Article 2, governs the licensing of family child care and child care centers, child foster care settings, and private child placing agencies. Article 3 contains the proposed Chapter 142C, which governs the certification of license-exempt child care centers. Chapter 142D, found in Article 4, governs early care and learning programs, Head Start, the quality rating and improvement system, after-school community learning programs, early learning scholarships, and related programs. Article 5 contains the proposed Chapter 142E, which governs the Child Care Assistance Program, otherwise known as CCAP. Article 6 contains the proposed Chapter 142F, which governs the Food, Housing, and Community Support Programs, including the Supplemental Nutrition Assistance Program, or SNAP. Chapter 142G, found in Article 7, contains statutes that govern the Minnesota Family Investment Program, or MFIP. And finally, as I mentioned briefly before, Article 8 contains conforming changes to statutes that are not moving or being duplicated, but that are needed to effectuate the transfer of duties to the new department, such as adding the commissioner to the maltreatment of minors reporting requirements. And finally, I want to reiterate that this recodification is not intended to change existing policy or to have a fiscal impact beyond the reorganization of executive branch functions and the establishment of the new department. This recodification is merely the specifics of what was passed last session and provides the statutory infrastructure for the Department of Children, Youth, and Families. I can be available for any questions, Madam Chair.
Thank you, Ms. Hoffman-Litchi. Mr. Treffs, did you want to go next?
Sure, yes. I can explain the 2 amendments in front of the committee. By the way, I'm sorry, I'm Dean Treffs. I'm an assistant revisor, and I helped put together the bill along with Ms. Hoffman-Litchi and nonpartisans in House Research, as well as a lot of coordination with MMB.
Mr. Treffs, could you
yes.
come closer to the mic?
Sorry.
Thank you.
Ms. Hoffman-Litchi, myself, other nonpartisans, along with a lot of consulting with MMB, MDH, and DHS, helped draft this bill together. And the 2 amendments could be seen as doing the same things. They are both kind of fixing some language that just didn't get caught in time, updating things, like a lot of it would be like striking things in current licensing statute in DHS that are still referring to child foster care, which is already which is being moved in this bill, and just catching some cross-references changes, those sort of things. They are both technical, and they've both been screened by both myself and I believe partisan staff for that technical status.
Madam Chair, did you have any comments on the bill or the amendment?
I do not. Can we take up the, let's see, which one does it matter which order we?
No.
Okay. The A240202 amendment. I move the A240202 amendment.
Okay, so we will take A24-0202 as an author's amendment. Senator Abler, did you have a question?
No, after the amendments.
Okay. All those in favor of the amendment, say aye.
Aye.
All those opposed? The amendment is adopted. Madam Chair,
Madam Chair, I would like to move the 824-0206 amendment.
Senator Wiklund moves the A24-0206. Any questions on that amendment? All those in favor, say aye.
Aye.
All those opposed? The amendment is adopted. To the bill as amended, Senator Abler.
Well, thank you, and is it Trask?
Trefts.
Treps, yeah. I just was, with the challenges in hiring state employees, I wonder when you interview them to be a revisor, you tell them they're going to have to make one of these.
They didn't tell me, Your Honor, sir.
Ms. Hoffman-Litchie, the rest of you, I admire your attention to detail, and I admit I have not read the entire bill, but I've learned to check out repealers, so I do have questions on two of those. I'm not sure who to ask, but so on page 2R, it talks about 256.9831, the benefits gambling establishments. You can't use a card at a casino, an EBT card or whatever. Is that a change in policy, or is that covered somewhere? I kind of remember when we passed that. If you're here long enough, you remember some of this, but can somebody answer that, please, Madam Chair?
Madam Chair or Ms. Hoffman-Litchie?
Madam Chair, Senator Abler, could you tell me what page?
Yeah, 2R.
Oh,
It's the
I can
the benefits gambling establishments, 256.9831. It's way at the back. Yeah. It's like the last page
I'm
of
just
the,
finding it real quick in the bill.
Okay.
the repealer bit. You can look at mine if you want.
Yeah, so 2R is the last page, but then I don't know where it shows up. Madam Chair,
Madam Chair.
Mr. Trefts has, I think, can
Mr.
respond.
Trefts.
Yes, I'm trying to find it in the bill, but it's, Control F is failing me right now, but I can get there soon. What we're doing with that one is I believe that statute was being compiled into like several different things into subdivisions of a larger EBT card statute in 142A, the kind of.
So it's still in there, I mean, it's still elsewhere?
Yes, no, like.
You still
if-
can't use the EBT card at a casino?
Correct, that is, because of the nature of.
Well, that's
you
fine,
can't
I
copy.
don't want to read it and find it, you just tell me it's in there, I'm happy.
It is in
about
there.
that. And Madam Chair,
Senator
just
Abler.
one more question, and maybe it's the same answer. I recognize some of these are, stale as can be. You have to get a report done by 1998. I hope you can hurry up and get that one done. But on page 1R, the 245-818, the child passenger restraint thing, is that also put somewhere else? Because I remember we worked on that too. Mr. Trask, if you're the one to ask. Just tell me it's in there somewhere.
Ms. Hoffman-Litchie.
Madam Chair, Senator Abler, it's the same situation. It is moved into Chapter 142B.
Okay,
Senator Abler.
thank you. Yeah, I ran on this recodification, and so pleased we can finally get it over there. Maybe that's
Super.
not true, Madam Chair. Thank you very much. But good work to the staff, and, hopefully that the project can be as successful as the paperwork leading up to it. So, thank you.
Other questions, comments? Seeing none, Senator, would you like to move that Senate File 3770 be
As amended.
passed and re-referred to Ed Finance?
Madam Chair, I move that Senate File 3770 as amended be recommended to pass and be referred to Education Finance.
All those in favor, say aye.
Aye.
All those opposed? Senate File 3770 is passed and re-referred to Ed Finance.
Thank you very much for coming.
Yeah, no problem, thanks.
Is this one getting laid over? This one's for judiciary.
Now we will move to Senate File 2611, and Senator Utke is bringing this forward. Senator Utke, do you have an amendment for your bill?
Thank you, Madam Chair. Yes, we have the A1 amendment, and Madam Chair and members, this bill before us, we actually passed out of both bodies back in 2022. It got put in an omnibus bill that just never made it across the finish line. So the language.
Senator Utke, I'm sorry to interrupt. We don't have the amendment distributed, so.
Oh, okay.
Let's get that so members have it. Thanks. Thank you. Oh, okay. Okay. Do you want to move forward with it as an author's amendment, and then you can present the bill?
We can do either. I was going to give you just a little bit about what this amendment was doing.
Okay.
So that we'd understand why we've got this. And again, we started with the original language that was passed 2 years ago, but the Department of Health has weighed in on the language. And what we see in the A1 is a result of their input on the bill. And the A1 amendment, just quickly going through it, you'll see it further defines direct supervision when we talk about the transfer care specialists. You can go down to line 1.16, and it talks about the number of individuals that a licensed mortician can supervise. That number was changed from 6 to 4. And in the rest of the amendment, just further defines registration and training requirements for this position. So, Madam Chair, that is what the A1 amendment does to our bill today.
Would you like to move the A1 amendment?
Yes, I would. I would move the A1 amendment to Senate File 2611.
Members, are there any questions about the amendment? All those in favor of the A1 amendment, please signify by saying aye.
Aye.
Any opposed? The amendment is adopted. The motion does prevail. So thank you, Senator Utke. Do you want, go ahead and present.
I'll do a quick introduction, and we'll turn it over to our testifier here this morning. Members and Madam Chair, this bill creates a category of registration called the transfer care specialist. Currently, only licensed morticians can make removals. With this bill, a transfer care specialist could remove a body from the place of death and transfer to a licensed funeral establishment. Points of information concerning this bill. Within the bill, you will see that the training requirements, license requirements, and the definition of required direct supervision are spelled out. The transfer care specialist must be an employee of the licensed funeral establishment, and the transfer care specialist must be registered with the Department of Health. And the registration includes the applicant's information, the supervising mortician's information, proof of completion of the training program, payments of the appropriate fee, and the training program and continuing education required for this position. The transferred care specialist must complete training prior to the initial registration, and the initial training program consists of 7 hours. The transfer care specialist must complete 3 hours of continuing education annually and submit the registration upon renewal. The reason for this position, this legislation will benefit Minnesota families by facilitating more timely removals from the place of death. In this industry, like every industry that we talk about here at the Capitol, there's a workforce shortage, and this is something that will definitely help out our licensed morticians to do a more timely job and help out these families at a time when they really need us most. So with that, Madam Chair, I would like to turn it over to our testifier to further tell us about this bill.
Thank you. Welcome to the committee. Mr. Dingman, please state your name for the record and begin your testimony.
Thank you, Chair Wiklund, and members of the committee. I'm Brian Dingman. I'm a licensed mortician and co-owner of Dingman Funeral Care. I'm speaking on behalf of the Minnesota Funeral Directors Association, which is made up of more than 600 licensed funeral directors and over 250 licensed funeral establishments. We want to thank Senator Utke for his work on Senate File 2611. This language represents agreement among the many voices in our profession. Over the past few years, MFDA has worked with its members, non-members, those seeking to enter funeral service, and the Minnesota Department of Health to address the issue of removals, specifically the prospect of removals by non-licensed individuals, a duty that current law requires be carried out by a licensed mortician. Using this feedback, MFDA worked to achieve the goal to allow those who are not licensed morticians to make removals, including important measures to protect the public health, protect the individual performing the removal, and protect the dignity of the deceased. We believe Senate File 2611 accomplishes these goals. Primarily, it permits a licensed individual, unlicensed individual, referred to as a transfer care specialist, to make removals from the place of death. It requires individuals to register with the Department of Health, which provides the department with oversight of the individual. It requires supervision by a licensed mortician, and it requires training. This training is an important piece to ensure the transfer care specialist knows proper removal procedure, potential health and safety concerns to the individual and the public, and the ethical care of a decedent. Senate File 2611 is years in the making, and we appreciate all the stakeholders who weighed in. It will provide a new option to carry out the duty of removals and will give new opportunities for those looking to enter the funeral profession. Again, I want to thank Senator Utke for leading on this issue and Chair Wiklund and the committee for your time and consideration. Thank you, and I will be available for any questions.
Okay, thank you. Do you have another testifier that, is there another member of the public who wishes to testify? I have a Robert Archbold. If you can come forward and. And Mr. Dingman, if you can please sign in on the sheet, I would appreciate it. Welcome to the committee. Please state your name for the record and begin your testimony, and then when you're finished, if you can make sure you sign in on the sign-in sheet.
Thank you, Madam Chair. My name is Robert Archbold. I'm a licensed mortician here in the state of Minnesota. I'm also a licensed funeral director, embalmer, and cremationist in the state of Arizona. Here in Minnesota, I have formed an advocacy group of funeral service professionals called the Funeral Service Roundtable. We are in full support of the legislation, and some of the letters that the Funeral Service Roundtable people have written in support of it, I think, are in your packets. I just wanted to say that we are in full support along with the association.
Thank you very much. Members, do you have any questions about the bill? Senator Abler.
Well, thank you. I know this has been discussed for a while, and it seems like it's an idea whose time has come, And I know the governor had an executive order to work on this very thing. Can somebody just clarify for me? I think this is a great idea, and maybe if you're short of people doing this, it could even be more expedited somehow. But how did the governor's executive order compare to this piece, either theoretically or practically?
Mr. Dingman?
The governor's order removed any requirements for who can make transfers. So with the governor's order, any individual can make a removal from the place of death.
All right.
So this bill has the training the supervision component of it. The governor's portion had a supervision, but that was the only component that it had in there.
Madam Chair, that's
Senator
helpful.
Ebler.
And it worked out pretty well, I think. So, I mean, you're even making it tighter, which is fine with me. Maybe if you could tell me, Madam Chair, like how long will this take to take effect? So it's going to be, if it's, I don't see an effective date, so it's August 1st perhaps, and then the department has to stand it up. Is that going to take a little while, or is it going to get you the relief you need as soon as you need it?
Mr. Dingman?
Well, first off, we don't want to rush it. We don't want to push it to a point where it's not ready to go, because then that's how we get the heirs that start with it, and that's not what our industry wants. However, we have been working, we have a task force within our association that has the complete outline of the training all set so that we can really start going. We've been working with University of Minnesota, actually Mortuary College in Milwaukee, Wisconsin as well, and different morticians in Minnesota, so that once it is ready legislatively, we can get the training going so that from there, as soon as the health department's ready to accept registrants, and I can't speak to their timeline, we will have the training already out there so that people can register immediately.
Senator Ebler?
Yeah, I appreciate it. Me and my father passed away a year and a half ago, and fortunately there was the local funeral home was able, but I just happened to be there when they took him out, and so it's a big deal if you can't get your loved one to be removed, and so just as this goes forward, maybe if there's a way to, I mean, I'm totally think it's a great idea, and the Department of Health might take some time to set up their stuff, so if we can just make sure that it's going to be as expeditious as possible, so when it takes effect, you can help these grieving families to be squared away. So anyway, thank you, Madam Chair. That's all I have.
Thank you. Any other members have questions about the bill? I don't have any other questions. It seems like this has been well thought out and discussed over many years now. It does seem like a way to help morticians who might be, the only one available and having to be on call at all times to be able to reduce their workload. So appreciate your bringing it forward. This bill needs to go from here to judiciary. And so we will be, the motion would be to recommend that Senate File 2611 as amended be passed and referred to the Committee on Judiciary. Would you like to make the motion, Senator Utke?
Thank you, Madam Chair. Yes, I would. I would like to make a motion that this bill do pass and be re-referred to the Committee on Judiciary.
Thank you. Members, all those in favor, please signify by saying aye.
Aye.
Any opposed? The motion does prevail. The bill, Senate File 2611 as amended, is passed and referred to the Committee on Judiciary. Thank you, Senator Utke. Next, we will have Senate File 1234. Senator Kupec. And just as a general note about the bills that we're taking up that relate to scope and professional licensing, many of them we will lay over for possible inclusion in some kind of an omnibus later in the session. This bill, Senate File 1234, is one of those that we will be laying over today. Others, if they need to go to other stops, other committees, then we will refer them on to those committees. Senator Kupec.
Thank you, Madam Chair, and good morning. And this bill in some ways ties into the last bill because it is actually also a workforce issue that we'll be taking up. It's a highly technical and complicated bill. It changes one word from the word and to the word or. And will basically allow dental assistants who've trained in other areas who've not necessarily gone through a school, but have maybe trained with another dentist, but they pass all the criteria to be a dental assistant, to allow them to also be a dental assistant here in Minnesota. Most of our surrounding neighbors have this policy in place, so it's a workforce issue, particularly my district, which is out on the border of North Dakota. It is an issue with people moving back and forth between two states, taking jobs there. So it will allow open doors for more people to be in another area of our workforce that is lacking some employees. So with that, I'd like to turn it over to my testifier.
Thank you. We have Dr. Rose Perpich. Welcome to the committee. Please state your name for the record and begin your testimony.
Yes, good morning, Madam Chair and members of the committee. My name is Dr. Rose Perpich, and I'm the president of the Minnesota Dental Association and a practicing dentist in Stillwater, Minnesota. I attended the University of Minnesota and have been practicing private practice family dentistry in Stillwater for over 25 years. On behalf of our organization, I thank you for providing me with the opportunity to testify on Senate File 1234. Like most communities across the country, Minnesota faces a dental assistant shortage. Dental practices have found it difficult to fill open dental assistant positions. Many practices have had vacancies for over a year, particularly in rural communities. Some dental clinics are unable to provide services to patients due to having to lower doctor hours because they can't find assistants to work. One of the many reasons for this shortage is that Minnesota currently has barriers to licensure for out-of-state assistants. Some qualified dental assistants willing to find meaningful employment in Minnesota cannot do so without a substantial burden. Currently, a dental assistant seeking licensure by credentials is required to have graduated from a dental assisting program that is accredited by the Commission on Dental Accreditation, or CODA, and be certified by the Dental Assisting National Board. Other states, such as Wisconsin, Iowa, and the Dakotas, do not have this dual requirement. For example, Iowa requires that a dental assistant graduate from a CODA-accredited program, but the applicant can apply if they have been certified by the national board. South Dakota requires one or the other, but not both. There are qualified and well-trained dental assistants in those states that want to work here in Minnesota. I personally have interviewed people from Texas, California, and practicing in Stillwater, many from Wisconsin, who have gone to schools in other states, but if they're not CODA accredited, their application cannot be considered by the Board of Dentistry in Minnesota. Senate File 1234 changes the application criteria to allow dental assistants seeking to apply for licensure by credentials regardless of whether they graduated from a CODA-accredited program, as long as they are certified by the national board, which they do go to dental assisting programs in other states, they're just not CODA-accredited programs. Additionally, applicants of a CODA-accredited program who are not certified by DAMNY would also be eligible to apply with this one-word change in the file 1234. This bill does not change a dental assistant's scope of practice. It simply expands the applicant pool to provide more candidates that may be qualified for licensure, people moving to Minnesota because of spouses changing jobs, or people who are in the service, armed services. If their spouses move to Minnesota, they can apply to be a dental assistant in our state. It is important to note that applicants still need to demonstrate that their non-CODA accredited program is comparable to the curriculum of CODA. Applicants would also still need to meet all other application criteria and requirements from the Minnesota Board of Dentistry. And additionally, in Minnesota, there is a dental licensure exam just for Minnesota that they would need to pass. This bill does not lower the standard of dental assistants. The Minnesota Board of Dentistry determines who obtains a license, so if an applicant's credentials are not suitable for licensure, Minnesota, it can deny the application. While Senate File 1234 will not solve Minnesota's dental assistant workforce issues, it is a step in the right direction that the legislation can take to improve our workforce current situation. Madam Chair and members of the committee, I urge you to support this bill. I would like to thank Senator Kupec for sponsoring this bill, and thank you for hearing this important piece of legislation, and I'm happy to answer any questions from the committee.
Thank you. Members, do you have any questions about the bill? No. Not necessary. It seems like one of the more efficient bills that we have this session with a one-word change. Sorry, we will be laying this over. Senator Kupec, did you have any other comments?
No, I just, thank you for the consideration of it. And it is, again, as so many of these bills, like the last one, addressing workforce shortage issues, it's important.
Yeah, it does seem important. And so Senate File 1234 is laid over for future consideration. And last on the agenda, we have another Senator Kupec bill. That is Senate File 3523. And this relates to establishing licensing requirements for behavior analysts. Senator Kupec.
Thank you. And this is a longer bill than one word. So I will draw your attention here to this map. I'm a geographically inclined person here. This is the U.S. licensure of behavior analysts, and you can see Minnesota sticks out as not having any. All of our neighbors all the way around us have this licensure program, and really we're kind of sticking out here, and it becomes a concern where people who work in one of those other states and say they come into some sort of violation with that standard, even something simple as like dating a patient, which you shouldn't do, they could easily then just move over to the Minnesota side of the border, hang their shingle up, and they're a behavior analyst in Minnesota because we do not have any way to regulate those people here. So it's kind of a safety issue too for citizens of Minnesota and going forward, and then obviously again, living on the border community, this is a problem. Somebody in Fargo, North Dakota could do this, violate something, and they could just move over to Moorhead, keep seeing all the same patients, and nobody would even know, and they would set up over there. So I look at it primarily coming as a consumer protection issue also. But I have a few testifiers here as well who can, one here and one online, who speak a little bit more about why this is necessary.
Thank you.
Dr. Larson, please state your name for the record and begin your testimony.
Thank you, Madam Chair, members of the committee. I'm Dr. Eric Larson. I'm a licensed psychologist in Minnesota and also a board-certified behavior analyst. I'm also the president of the Autism Treatment Association of Minnesota, which is a trade group composed of 13 provider agencies that work in family homes and community centers with children and adults with autism. The Minnesota Department of Health estimates there are approximately 100,000 children in Minnesota that have behavioral health disorders, and medical assistance covers the treatment of 32,000 of those children. Our member agencies at the Autism Treatment Association serves 6,000 of those children. What a behavior analyst does is they work as part of a system of coordinated care with the other helping professions. The behavior analysts go right out into the community, in the field, in families' homes, in community centers, group homes, hospitals, directly observe the challenging behaviors such as isolation and aggression, self-injury that children that need help are displaying. They identify an objective system of measurement and evaluation for these behaviors, and then implement reinforcement and training systems that can remediate those behavior disorders. They follow that up with ongoing direct observation, again, out in the places where the behaviors are causing concern, and adjust the training and reinforcement systems with their colleagues in order to further improve the children's needs. The Several organizations have submitted letters of support, which are in your packet. The Minnesota Northland Association of Behavior Analysis, my organization, the Autism Treatment Association of Minnesota, Fraser, and I believe perhaps some others have come overnight, all in support of this bill, along with the Board of Psychology and the Minnesota Psychological Association. The Council of Minnesota Health Boards has reviewed the application and recommended that behavior analysts be licensed in Minnesota, utilizing the National Behavior Analyst Certification Board credential. There are currently 470 BCBAs with board-certified behavior analysts and board-certified assistant behavior analysts who hold that credential in Minnesota. As Senator Kupec showed, 37 other states, including all of Minnesota's surrounding states, already license behavior analysts. So the intent of this bill is to increase the availability of such services to children of Minnesota without interfering with the existing helping professions who can continue to deliver their services within their own scopes of practice. Minnesota bill will discourage those unlicensed and incompetent folks from delivering services and also regulate the practices of those who may have been sanctioned in other states when they try to move into Minnesota. This also then expands a career pathway for members of disadvantaged populations to move into this field through a tiered model of service delivery and training and supervision that is already well worked out by the Behavior Analyst Certification Board. So thank you.
Thank you. And the next testifier is on Zoom, Joel Bakken. If you can please state your name for the record and begin your testimony.
Yes, my name's Joel Bakken. I'm a licensed psychologist in Minnesota. I'm also a licensed behavior analyst in North Dakota. For the past 25 years, I've had the privilege of being the executive director of Solutions Behavioral Healthcare Professionals. Solutions is a nonprofit community behavioral health agency serving greater Minnesota. We have offices in Moorhead, Detroit Lakes, Fergus Falls, Alexandria, and St. Cloud. We have a staff of 320, including psychiatrists, nurse practitioners, psychologists, social workers, marriage and family therapists, professional counselors, and behavior analysts. All of these professionals are licensed except for the behavior analysts. Today I stand before you to stress the critical importance of passing this licensure process for behavioral analysts in the state of Minnesota. This legislation is not merely about regulation, it's about safeguarding the well-being and dignity of our most vulnerable populations. These vulnerable populations include behaviorally disordered children, individuals with developmental disabilities, and children with autism. These individuals and their families rely on our services, and it is our responsibility to ensure that these services are safe and ethical, and that our citizens receive the highest standard of care possible. I want to reinforce that passing this licensure process is not just a matter of compliance, it's a matter of protecting the safety and well-being of our most vulnerable citizens. Particularly, I urge you to support this legislation and prioritize the welfare of our communities. Thank you, and I'm ready for any questions that you may have.
Thank you very much. And then I have Sam Sands on here. Is it? Welcome to the committee, Mr. Sands, and if you could state your name for the record and begin your testimony.
Madam Chair, members of the committee, thank you. My name is Sam Sands. I am the Executive Director of the Minnesota Board of Psychology, which is the board in statute identified as administering the behavior analyst license in the proposed legislation. In January, the board voted to continue to support the language in this bill. We've been working on it with them for several years now. And the board believes that licensure for behavior analysts is the appropriate level of regulation needed to protect the public in this field. Behavior analysts provide access to crucial services to individuals with developmental disabilities, children with autism, and their families. These individuals are often vulnerable adults or children that may have an impaired ability to protect themselves from maltreatment. So licensure is the appropriate level of regulation. As was previously testified to, 37 states have it, including all of our neighbors. When I was reviewing the disciplinary documents from states that have licensure of behavior analysts, the need to protect the public is apparent. We see violations that lead to violations in other states that are financial and in some instances physical abuse of clients. Boundaries violations, failure to safeguard client information, and failure to keep adequate treatment records. These allegations are all of the same kind of nature that the Board of Psychology currently regulates in the profession. Licensure regulation would provide the state with an appropriate regulatory tool to protect the public. Currently, voluntary certification system is used for behavior analysts, and that leaves kind of some gaps in public protection. Behavior analysts aren't required to register with the national certifying body in order to provide services in Minnesota. And the certifying body does not have all the tools that a state licensing board might have that can compel cooperation with a board investigation or abide by an agency determination. Finally, the certification board can strip a behavior analyst of their certification, but the state agency can actually stop them from practicing in the state. Clients don't have great remedies under the current system of certification. In addition, the bill identifies minimum competencies of a behavior analyst must have in order to practice in the state, and the competencies are identified are well in line with what other states are requiring. So this legislation equips the state with tools it needs to ensure that only qualified individuals provide behavior analysis in Minnesota, and the bill also establishes an efficient and effective system to investigate and adjudicate complaints. Thank you for your time allowing me to testify on this bill, and I'm happy to answer any questions you might have for me.
Thank you very much. Members, do you have questions about the bill? Senator Mann.
Thank you, Madam Chair. Is there any concern about when this licensure goes into play that there are people who are currently practicing well that won't be able to get their license on time, so now they're doing something against the law or they can't see their patients? Is there like a seamless transition ready to go?
Dr. Larson, would you like to answer? Or?
Except perhaps Mr. Sands has experience with implementing.
Mr. Sands?
Thank you, Madam Chair, Senator. So what I would say is that in the drafting of the language, we met with a lot of stakeholders to make sure that we were addressing these areas where people might be providing services currently that might lose out and if they're not kind of put into the exemptions to practice, and that we covered as many of those as we could. So for instance, people providing those services in schools that might choose not to get the license would still be able to continue to provide those services in that school context under this bill. There is a chance that maybe some people would be caught without being able to practice, but to be honest, from the board's perspective, when we discussed this, that we thought that those numbers might be fewer because of the exceptions that we're making to licensing, and also that the public protection would outweigh the need to have those individuals continuing to practice that small number.
Yeah, and Madam Chair,
Dr. Larson?
Perhaps the other part of your question was during that transition period, so on whatever date this law goes into effect, now all of a sudden 470 currently certified behavior analysts will need to apply for a license. And that's what I can't answer, is how quickly might the board then license each of those existing certified professionals?
Mr. Sands?
So, I think in the bill, thank you, Madam Chair. I think in the bill there is a provision for the 470 that you're referring to that would be a matter of them submitting an application and us conducting a criminal background check and verifying the status of the credential, that they have the national credential. I would imagine that there'd be minimal delay in that process for individuals who aren't traveling that national certification pathway. That would be a little bit more of, I'm not quite sure what the timeline might look on that one.
Senator Mann? Senator Utke?
Thank you, Madam Chair. And actually just taking kind of the same conversation another step just for information. You mentioned 470 individuals that this would affect, but are any of those licensed for other portions of the psychology and such? So this would just be adding another license, so they're already used to the process and part of the system?
Dr. Larson?
Senator Utke, I'm a licensed psychologist and a board-certified behavior analyst. There are 23 of people similar to myself in Minnesota, so we would automatically actually already be licensed because we're already licensed psychologists. The intent of and the way the bill is structured, the Board of Psychology is going to ask for you to submit records that you're already certified as a behavior analyst, and then again passing a background check, immediately license each one of those remaining 450 or so people. So again, I think the big question is just how quickly does a new regulation take effect? Is there any grace period? And I don't think that is in the bill.
Mr. Did you have more to add, Mr. Sands? Okay. Mr. Bakken, I see your hand is raised.
I'm sorry, Senator
There you go.
Utke, I'm sorry, Madam Chair. I might be able to answer your question from an outstate Greater Minnesota area. We do have professionals that are currently BCBAs and also licensed in another mental health profession. For the most part, those folks have chosen to do that because of the skill set they would have under becoming a BCBA or behavior analyst. I am not aware that this number is that high. I would assume it's fairly small, at least in Greater Minnesota. Thank you.
Thank you. Senator Abler?
Well, thank you, Madam Chair. I'm really happy this bill is moving. I've been working on this since, I think, 2015. And it's just nice we found a more capable legislator to actually move it as far as it's going to be going. So congratulations, Senator Kupec. We had a lot of negotiations with Mr. Sams and Dr. Stark and Dr. Larson and other people, Ms. Haley and a whole crew. So there's protections in here, and I have a comment about that, but I believe it's actually going to draw more into the practice. There is a dearth of people to help serve these young people with autism, and with the different early intervention methodologies, you can actually, if you start young enough, before 3 or something, you can actually remediate a lot of the ongoing problems that the person might otherwise have, and you need more of these people. And we discussed at length how many different, there's a whole whole rubric of who can do something, and you got Dr. Larson, you got the BCBAs, and you got some the assistants, and you got technicians or something, I forgot all the words, but kind of, some things go away after a while, Madam Chair. But anyway, so how many can they oversee, and how can we find a way to help more kids actually move through autism and not have to face that as their defining thing in their life? And so this is, I think, really important. And so it was a long way to get to what this paper said. I presume it's very similar to what we left on. There's some dust on it, so I think it's the old version that we funded. But it was a hard slog with the psychologists and all the interested parties. So I'm really glad it can move. And they're just in the discussion, not to do anything to cause harm, but if there are people that would be potentially fenced out, we don't want to lose anybody. And so this takes effect in 2025, January 1st, and you can't do the practice or say you are based upon that. So I think Senator Mann's question is valid, and so maybe just a little paragraph allowing, phase in as long as they're working on something would, because just to avoid, and I'm happy to meddle with that, but the bill is, at the worst case, the bill should go forward the way it is, just to get more people to want to come and help us in Minnesota. But I think the question about that little, what happens on a phase in, this bill was, I think this draft is 4 years old or something, and the dates made sense then. They've been updated just kind of maybe randomly, so maybe we should just look at that with Mr. Sams and others. So, but it's a good bill, Madam Chair, and thank you for putting this on your docket. I really appreciate it.
Thank you. Any other questions or comments? This bill needs to go to a couple other places. We will be sending it to judiciary, and then it will also need to go to state government because it has an advisory council in it. So,
Madam Chair,
Senator Abler.
I thought you liked the bill, and now we're sending it to judiciary. Can I just ask what element?
Sure
is there a crime in here or something that we create?
Well, there's penalties, I believe, and there's
penalties. I'm curious. So.
Mr. Hudala, can you answer that question?
Thank you, Madam Chair and members. There's a few different reasons why it's getting sent to judiciary. As you'll see, there's a duty to warn under certain circumstances, limitations on liabilities, and then there's also a misdemeanor which could potentially go into effect with strict liability, which are things judiciary would handle.
Thank you, Madam Chair. I appreciate the answer.
Thank you. So that will need to happen. One question I had just before we move it forward, I just wanted to ask, can you talk about or describe kind of what the difference is between the assistant role and the just the behavioral analyst role? Kind of what they do that's different. I noticed that there's a different level of schooling, degree level, but if you could, can you describe kind of what they do differently?
Yes, Madam Chair. The Behavior Analyst Certification Board came into being in 1998, and during that time, the field of behavior analysis has grown dramatically in those past more than 25 years now. Throughout that process, the certification system has been expanded to recognize the need to develop a workforce in a responsible manner. So this bill does not mention the registered behavior technicians, which is the ground level of service provider that does not require a bachelor's degree. The assistant level requires a bachelor's degree and university training and supervised field work. And then the full behavior analyst level requires a master's degree and a year of supervised training in order to attain that level. So that this tiered system of the profession is a way of expanding the workforce as rapidly as possible. People, in effect, can move through the stair steps up to the final level. As a result, today there's over 200,000 credentialed people who are credentialed by the Behavior Analyst Certification Board, and that number continues to accelerate based on the success of this tiered model of training and supervision.
Thank you. Senator Hoffman.
Thank you, Madam Chair. So, nice to see you, Dr. Larson. There's a deep need for functional behavioral analysts within the school district system because we're seeing all that. If I understand this right, by you elevating that workforce issue, that will also have a direct help for districts that need more and more. That's happening a lot. Is that a true assumption?
Yeah, today yes, Madam Chair, today there's approximately 70 board-certified behavior analysts working in the schools, and I think that's obvious to anyone who's looked into the special ed system. That's hardly enough to go around. But as a result of the work of the Behavior Analyst Certification Board, that number's greatly increased over the past 25 years.
Senator Hoffman?
Madam Chair, I think that there is such a deep need within the school. I mean, this is really issuing it, and I just would hope that maybe one of the other committees could just waive. I mean, this thing, we should pass this year. I mean, it really should be. I'll make a motion to send it to the floor, but I wouldn't do that. I'm just kidding. But it's that I just felt the anxiety of the fact that I know what our school districts are, and I'm not even on education anymore, but that is still such a prevalent issue. So I don't know how we can help elevate it getting through judiciary. So thank you.
Well, I think Senator Kupec can make sure he passes along the sense of urgency to the chair and the committee administrator, and it does seem like it is very timely and that it is important for us to take action on this this session. So, but we will get it started on that path, and we'll ask you to keep working on the language. So I guess the motion, Senator Kupec, would be to recommend that Senate File 3523 be recommended to pass and be referred to the Committee on Judiciary. Would you like to make that motion?
I will make that motion, as much as I love going to judiciary.
Members, all those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail. The bill is passed and referred to the Committee on Judiciary.
Thank you.
Thank you, testifiers as well. And so we are at the end of our agenda. We do have bills scheduled tomorrow that relate to professional licensing. And on Thursday, we will have more of those. So please look at the agenda, and you will be provided again the information that was provided today, which is the proposal or questionnaire responses that we received from the different entities that are in support of these proposals, and look forward to the discussion tomorrow. Seeing no other further business on our agenda, this meeting is adjourned.